Joanna Castro and her husband played by the rules, worked hard all their lives, and were rewarded by being able to retire early and spend time with their children and grandchildren. They had always received health insurance through their employers, so when they retired, they logged on to healthcare.gov to check out their options. As someone who worked in the healthcare industry, Joanna was a supporter of the Affordable Care Act's ability to provide insurance for society's most vulnerable.
I was excited because in my healthcare career, I had seen a lot of people who didn't have healthcare. And so because they didn't have healthcare, as they aged, they got sicker and sicker.
They did their research and picked a plan with a premium of more than $1,500 a month. That worked for them, particularly as Joanna has a pre-existing condition. Then in the fall of this year, they received a letter that their provider was no longer carrying their plan. They found a replacement, but it raised their costs dramatically.
Our deductible has gone up, our premiums went up $400 a month, our out-of-pocket limit has elevated, but the biggest part is our network, our provider network shrunk like you cannot believe. I mean, we are geographically bounded to local hospitals and local physicians. It's not even that I don't have the one of my choice, I have none.
They're not alone. In 2016, major providers such as United Healthcare and Aetna have pulled out of the Illinois market, while smaller providers such as Land of Lincoln have gone belly up, leaving residents with fewer options and higher premiums.
They're going up 44 to 55% on average for the lowest priced plans in each tier, and that's for next year. And that is going to be for everyone buying insurance on the exchange in Illinois.
The reasons are complex, but the bottom line is insurers were losing money.
The insurance companies were expecting more healthy people, more younger people to sign up to help offset the costs of paying for the sicker older people, and that hasn't happened to the degree that they were expecting. Also, they were supposed to get a certain amount of money from the federal government to help with these first few years of the exchange, and they haven't gotten as much money from the federal government as they were expecting either.
Some experts say that the higher rates in 2017 will compensate for the low pricing and higher claims in 2016 and thereby right the ship. But that does not acknowledge the elephant in the room, the election of Donald Trump. During his campaign, Trump was unambiguous on his plans for the Affordable Care Act.
That begins with immediately repealing and replacing the disaster known as Obamacare.
Since Trump's election, he has modified his stance, indicating he'd like to keep two of the most popular provisions of the health law.
When you replace it, are you going to make sure that people with preconditions are still covered?
Yes, because it happens to be one of the strongest assets.
You're going to keep that?
Also, with the children living with their parents for an extended period, you're going to
keep
very
that?
much try and keep that.
There are big questions out there right now about how that's feasible if you take away the requirement that everyone has insurance, because the fear is if that requirement isn't there, then all the healthy people are going to leave the market and the insurers are just not going to be able to sustain business paying only for sick people and not having any healthy people paying into the system.
That has healthcare providers deeply worried. Hospitals have the most to lose. For big city hospitals such as Stroger here in Cook County, the Affordable Care Act has made a huge difference. Before the law, most of the patients here had no medical insurance, so they relied on the emergency room for their health care. But with the expansion of Medicaid under the Affordable Care Act, 2 out of 3 patients here now have health insurance. Dr. Jay Shannon is CEO of the Cook County Health and Hospital Systems. President-elect Trump and the Republican Congress are now saying they are going to repeal the ACA and replace it. What keeps you up at night?
Well, I think the biggest thing is the idea of taking individuals who've had an opportunity now, maybe for the first time in years, they've got insurance coverage. It gives them not only access to care, it gives those individuals some peace of mind, it gives them some hope for the future. So the idea of taking that coverage away without a replacement product is nightmarish to me. And I think frankly, I think it's immoral. The patients are going to have a hard time with it. Hospitals and health systems are going to have a hard time with it. And doctors are going to have a hard time with it unless there is an adequate replacement plan.
Going back before the Affordable Care Act, is it fair to say Cook County hospitals were losing millions of dollars a year?
Yeah, absolutely.
And since the Affordable Care Act?
Well, it's shocking. We're just closing our third fiscal year where we have broken even.
As for Joanna Castro, she's nervous for the future, but she knows what her preference would be.
When I hear repeal and replace, I'm thinking that it's going to be a major tweak and work on it together and try to come up with something that works for people.